My name is Rebecca Columbo. I got involved with the opioid epidemic because I lost my daughter Maya Columbo in 2017 to an opiate overdose. My daughter was a beautiful, talented, compassionate young lady. She volunteered in the community and she was employed. I believe her struggle began in about 8th grade. She had trouble fitting in at school. She was overweight, had some self-esteem issues, and she was a perfectionist. She was an artist, and I feel like in that mindset, whenever she didn't make high on a roll, whenever she had some kind of perceived failure, it really did a lot of harm to her self-esteem and to her as a person. So I really think that she started using at first marijuana and alcohol as a means to fit in and give her some relief from some of the anxiety and depression that she was having. Once we found out she was using marijuana, and she got in trouble her freshman year of high school. I got a phone call from the vice principal, and they told us that she was being suspended for trying to buy marijuana on school grounds. And so I started asking her about this. It kind of came as a surprise because she was, before 8th grade, I thought like a normal kid. She was pretty happy and had a happy childhood. So it kind of came as a surprise. And once I started questioning her about it, she was pretty honest. I mean, she told me she was smoking marijuana probably 3 to 5 times a week. I kind of suspected maybe it was a little bit more than that, but she did share with me that she was. In addition to the self-esteem issues, I was very concerned about her mental state at that point, and I felt like she should start some kind of counseling and treatment program. So she went into outpatient chemical dependency after school program. So she graduated outpatient treatment. She actually did really well in the program. And shortly after that, though, we started noticing signs of an eating disorder. And we didn't know it at the time, but she was substituting the eating disorder for the drug use to cope with bad feelings. She went to a partial hospitalization program for her eating disorder. This was at a place in Fairport. She would go there in the morning. She'd get tutored for school and then participate in therapies in the afternoon. And she'd come home in the evening, and I'd have to monitor her meals, and on the weekends, help her cope with that. She did graduate from that program too. She did well in that program. After that, she started returning to drugs. The eating disorder symptoms started subsiding. Okay, so once Maya actually did really well in outpatient and graduated, she came home, but we didn't realize it at the time, but she was started substituting her drug use for an eating disorder. That was, I believe, to cope with the emotions that she was having, the negative emotions she was having. She did go to a partial hospitalization program for her eating disorder after she started showing those signs. That consisted of her going in the morning for tutoring and then therapies in the afternoon for her eating disorder. That got better too. She graduated from that program, and but not long after that we started finding evidence of drug use again. Marijuana, vapes in her room and car, and also she did share with me that she was taking pills from classmates, Adderall, Xanax, and using those. This is after, this is about junior year now that we're up to. She had gone to partial hospitalization for her eating disorder her junior year of high school. Things started really escalating her senior year. The behaviors at home were getting really tough to deal with. She has 3 younger siblings, so it was a challenge for me and my husband to maintain a normal home environment. And I hate to talk about her like she was a bad kid, because she definitely wasn't. She was a beautiful girl with just some serious mental health issues. And but I do have to make mention of the behaviors, because I think people need to understand why me and my husband had to have some disciplinary actions too. I mean, we were trying to get her to see what she was doing was wrong. But she was like stealing from her siblings. There were drug dealers coming to our house. She was driving under the influence. So some of these behaviors were just so hard for us to deal with. By her senior year, she didn't want to live by our rules, and we didn't want to back down from our rules. So it was kind of a mutual, you can't live here anymore. I don't want to live here anymore. About 6 weeks before she graduated, she started living with friends. She lived in between 2 different friends. So shortly after, she did graduate high school. Shortly after that, my husband and I started really worrying about her. So we decided to take her college fund, and we told her we would pay for an apartment for her for a year, and she could take care of all her other bills. We'll pay your rent, and you take care of your other bills. And we thought that that was a good compromise. It would keep her grounded here in Webster. We would be able to keep an eye on her. But what ended up happening was she, just got out of control. She had this place now where she could use more. And she did. She ended up really, really sick. She ended up, and this is, the drugs got more dangerous. She started using psychotropics, LSD, mushrooms, and eventually Dilaudid, and eventually she started experimenting with heroin at that point. She got really sick, actually, with an infection and had to be hospitalized. She wasn't eating properly, she was using drugs, and the infection was so bad that she needed IV antibiotics. And when she was in the hospital, she went into withdrawal. So my husband and I asked her to come home at that point. So she moved back home. Our family had kind of a family therapy night. We asked extended family to come over and help with convincing her that she was sick enough to go to inpatient. And she did agree at that point to go to inpatient. So she went to inpatient, and that's like a 2 to 3 week program. From there, the case manager told us to have her find a residential program. But she came back home. She came back home. It wasn't a direct transfer into a residential program. And I feel like that should have happened, because wait lists in our area are 3 to 6 months long. And we couldn't find an appropriate program for her. She needed something with mental health, something with possible medication to deal with her feelings. And I'll show you her artwork a little bit later, but you can see the depth of her struggle in her artwork. And I don't think that that's something that can be fixed in 2 weeks. I mean, that's something that is long term. It needs, to put her back into her environment, tell her to come home and go back to an outpatient program, which she had tried before. It just really wasn't enough for her. So she kept getting bumped down the list at these residential programs. They gave me reasons like she wasn't an IV drug user. She inhaled heroin. She never used a needle to inject heroin. And she also got bumped down the list because of the co-occurring disorders, the mental health and the addiction problems. So finding her an appropriate program and getting her into that program was nearly impossible. So from there, we found a Christian-based program down in Binghamton, and she attended that for 6 months. She actually did really well while she was there. She came home and told us that she wanted to enlist shortly after that, of all things, And I think she saw that as an opportunity to grow and make her own living, gain some independence, and maybe find a career path through the military. She bypassed a lot of their screening questions. She was not straightforward because they do have a process to get in. So unfortunately, those screening questions are put in place for a reason. And for someone with anxiety and depression underlying, the military isn't always the best choice. It's a high stress environment. And while she was in boot camp, she got very sick again. She started using her eating disorder once again to cope. And the military personnel saw this, her roommate saw this, and they put her in the hospital in Texas. So she was there for about a month. I went down and met with the doctor there and asked them to release her and told them that I would find treatment for her back home. I wanted to be close to her. I wanted to follow what was going on more closely. And doing it from Rochester to San Antonio, Texas, it was just nearly impossible for me to stay involved. So they did end up releasing her. There was a plan in place, but she didn't follow it. She came home and didn't want to stay with me and my husband. She wanted to stay with a friend. She got sick again with him. They started using again, and she ended up in treatment once again.
This is her boyfriend?
My daughter ended up in treatment once again.
Yeah, you said a friend.
Yeah, it was a close friendship. So from there, she went. We got her into another program. It was under mental hygiene arrest. They kept her for 3 weeks in a hospital in Boston. And as soon as that program became voluntary, as soon as they thought she was getting better, she signed herself out. So my husband and I brought her back home. And all those behaviors came back, and we ended up telling her she had to find someplace else to stay. So that weekend, she told us she was who she was going to stay with, but that person couldn't accommodate her either. He didn't want her staying with him, and he put her up in a hotel room, and that's where she overdosed fatally. She died on February 11th, 2017. I think the first emotion that comes to mind is fear. When I found out Maya had tried heroin, I knew how dangerous it was, or is. I'm a registered nurse, so I spent 7 years in the emergency room. So I saw kind of firsthand how dangerous heroin is, and knowing that my own child had tried that, the fear, it's a parent's biggest fear is to lose their child. At that point, I remember visiting her on her lunch breaks at work, and she had gone from this girl who really, really cared about how she looked and took care of herself to being very disheveled, poor hygiene. She would talk in things that wouldn't even make sense, sometimes in riddles. And we would have a hard time, like me and my husband both would have a hard time following what she was trying to say. That was, definitely another big concern for me, and a reason why my husband and I pushed her to go into inpatient at that point. I think her emotional pain came from severe anxiety and depression, poor self-image, and I think also she was probably subjected to a lot of dangerous situations with the types of people that she was surrounding herself with. I think she probably made herself very vulnerable in some situations, and people probably did take advantage of her in different ways. It makes sense that she would continue, if not worsen, to have poor self-image. Again, she never told me specifically about any traumatic event, but just by the way she acted, I do feel like there probably was at some point. One of her doctors near the end of her life had told me she believed by her presentation clinically that she may have been subjected to what are called microtraumas, and that's common in young women, and probably young men too, who say, okay, I will, for instance, maybe have sex with you if you can give me a ride to the store. I'll have sex with you if you give me a bag of marijuana. And although she never stated that to me or to her doctor, that was, a belief that we had just based on her behaviors and presentation. So we found out that Maya had died. My husband received a phone call from the Webster Police Department, and they asked us to meet us at our home. We were at my younger daughter's basketball game. So we came home right away, kind of had a gut feeling that something happened. And they came to the house and told us trying to think, I think when we told her that she had to find someplace else to live, I was kind of hoping that it would put her in a place where she would ask for help again, like she would ask to go back maybe to the Christian-based program, or I was hoping maybe for a lesser a less terrible outcome. Maybe she would feel so sick, because she was still struggling with the eating disorder as well. Maybe she'll pass out. Maybe she'll get so weak that she'll pass out, or maybe she'll overdose and she'll have to go to the hospital, and maybe she'll get in trouble with the law. But unfortunately, that's not what happened. Since Maya's death, I've done a lot of volunteering with some grassroots organizations here in Rochester. I've done some work with SOARS. I've done some work with Be the Change, Hope Dealers Be the Change. And I've also gone on some hikes, done some yoga classes, and been to some events with Recovery Fitness. I also volunteer at Angels of Mercy on Winton Road. So all of these organizations are wonderful grassroots efforts to help in this crisis. I go to as many events as my schedule lets me. So Angels of Mercy is an organization that they're like threefold. They have a butterfly boutique, which has donations of gently used women's clothing, and they distribute them to young women in need and older women in need. So any woman that has a history of maybe domestic violence, maybe substance use disorder, maybe they just have a chronic illness, or they had a fire or something happen in their house, this group of women will help find what these women need for clothing, for household items. The second part of that is they host Dress a Girl. And Dress a Girl is a group of volunteers that come in and they sew dresses for little girls in need. And these dresses get distributed right here in Rochester, all the way to places, third world countries. And it's been found that girls that wear these dresses with the label on them are less likely to be sold into human trafficking. And it's because they're counted for. The dresses are distributed usually through a church or some group, and they know how many dresses go out, and they know how many girls are wearing the dresses. So it's just like a fantastic program. I believe the opioid epidemic is being fed by overproduction of prescribing painkillers, the dangerousness of the street drugs. They're being laced with fentanyl, and also the vulnerability of our youth. I think they need to feel loved. I think our society is very fast-paced and competitive, and while competition can be very good, I also think that kids need to feel like they're not disposable. I think that kids need to feel like if they're not good at one thing, maybe they have a gift in another area. And as adults, we have to encourage them to find where they belong, make them feel loved and valued, and respect their individuality. Yes. Also, I think there's many barriers to good treatment, and I feel like these barriers to good treatment just feed the addiction and mental health issues even more. I don't know of anything that's not working, but I can speak on to some of the problems we face seeking treatment. Some of the problems we faced seeking treatment was the lack of residential living. Maya went to inpatient for 2 weeks, and the problem occurred when she returned back to her same environment, as in the same plan of care that as she had before she went in. I mentioned earlier how I think the depth of her problems are something that you can't just fix in 2 weeks of inpatient, and having a supportive program and a place to live would have helped her gain some independence and treat her underlying issues.
Is that picking that up?
She did have some physical withdrawal symptoms after she was hospitalized for that infection. But she ended up in inpatient, which is, I believe, more for intensive therapy, and not so much for the physical withdrawal symptoms.
Yeah.
So some of the flaws that we saw in the drug treatment were the wait times for residential living. And also, what I haven't spoke about yet is Maya was seen in the emergency room twice within the last 4 months of her passing. And both times she was held for the 24 hours for mental health evaluation and released. So she was not saying that she was suicidal. She didn't have an active plan for suicide, but her behaviors were clearly indicating that she did not have a will to live. She was using her eating disorder. She was down to about 100 pounds. And she was my height. She was 5'8". And she was using heroin. She was using drugs, dangerous drugs. So I don't understand why they couldn't have held her on mental hygiene arrest. You know, we ended up going to Boston for treatment close to the end of her passing, but in our area, the 2 hospitals in our area let her go.
After 24 hours?
Yeah, and they had she had the mental health evaluation by a doctor who sat with her for maybe 15 minutes. And again, like, even though because she didn't want to go back in the hospital. And I don't blame her, you know, she didn't want to be back in a hospital setting. But she needed it. She really did. That would have been the only way to save her life at that point. I think Casey's Law would be a wonderful thing to bring to New York State. Nobody wants to see their loved ones suffer. Nobody wants to go against what somebody is saying, that maybe they don't want to go into treatment. But that's part of the mindset of people with substance use disorder, people with inactive addiction. If they admit that they're having a problem, that gives them permission, or that makes them vulnerable to not be able to use, you know. And if they admit that, then they can't use and they can't feed their addiction. So they need somebody to advocate for them. Okay, so I feel like people in our community can get involved and help fight this opioid epidemic by using whatever gift or platform that they have, whatever that might be. For example, if you have a young family, you have kids that are school-aged, get involved with your school board. Find out what teachers and the school district is doing to advocate for mental health and addiction awareness. Tell them you'd like to see more of that topic. It's never too much. Another example might be if you work in law enforcement, you know, continue the conversations about decriminalization of marijuana use. Give information to people out in the community, those who need it. And what I would say to my state legislator would be to fund recovery services. These are beautiful, talented people with so much potential that we're losing every single day. Come to my city, meet with the grassroots organizations who are making a difference, and see how wonderful recovery can be. In addition, I think look into emergency room reform, consider these laws to help hold patients under mental hygiene laws, or work to change those laws so that patients can receive good evaluations and good plans of care that'll work for them and that they're willing to participate in. You know, working with patients to find out what they think would be a good recovery program for them. Funding recovery coaches. These are people that meet people with substance use disorder where they're at. They've been in their shoes, and they can really help people with substance use disorder. And then finally, funding more residential living. So I would definitely like to learn more about, what is it called, functional medicine.
Yeah.
I think it's a very interesting topic, and it certainly can be a contributing factor. Nutrition, we all know, is so important. And also mind, body, spirit. I think that approach would be really helpful to people with substance use disorder and mental health issues. I've found through my own grief process, the thing that helps me is yoga. And also, I listen to some YouTube vlogs on guided meditations, reconnecting with my loved one in spirit. And I don't know, for me, it works. You know, for some people it might not. But everybody has their own path, and finding what works is great. The functional medicine idea, I think, yeah, I think there's definitely probably some substance that I'd love to learn more about it. I think the needle exchange program is absolutely necessary. Our city actually has now 2 sharps disposal boxes in high use areas. Increasing these locations would better serve our community rather than taking away a program that reduces infections. I think it's better serves our community rather than thinking negatively about the program that reduces infection. I think the trend of opioid use, I don't know if it's slowing down. I think the grassroots organizations are absolutely wonderful. When I was going through what I was going through with my daughter, there was no Rock Recovery Fitness, there was no SOARS, there was no Be the Change.
Just a couple years ago.
Yeah, this is just 5 years ago. Gates to Recovery, that's another one that have popped up within the last 5 years. And again, I think for one thing, my daughter would have done better with a peer support than she did state to me at one point that she felt like doctors and me and my husband were talking down to her. And back then, the mentality was tough love and rock bottom. They were very popular concepts, and I think that approach is changing. I feel like with all the awareness and ending the stigma, trying to end the stigma, our community is coming to a more compassionate approach to substance use disorder, and I hope that continues, because I think that that's the way out of this.
Do you have any?
I think as it affects more and more people and more families, that mentality will change, because it does break all cultural barriers and family barriers. It doesn't discriminate.
Yeah.
And it affects everybody.
Yeah, I was thinking.
And whether it's happening on Webster Avenue or Webster Park, I mean, it's still happening, To someone in active addiction and their family, I would say that your life matters. I would say you're valued, and never give up, no matter how hard things get. Never, keep trying.
Who is in active addiction?
To a parent who has someone in active addiction, I would tell them to continue to support their child no matter what. To keep letting them know that their child is loved. I would tell them to do anything they could to support their recovery. That's about it. To a grieving parent, I would say take care of yourself and find what works for you. Take care of your mind, your body, and your spirit. Your feelings are going to change from day to day, and just tell yourself that, the really, really bad times will pass, and you're never going to forget your child. You're never going to stop loving your child, but the really, really bad, dark, deep times will pass, and they might come back again, but you just got to push through it.
Easier.
I don't think it gets easier, but it changes. I think, initially, like the first year and a half, it was very traumatic, very unclear thought patterns. You just try to get through the first of everything. It's very much, I just task focused, just did whatever I could to get through each day. Now, I still have very, very dark times, and it could last an hour, it could last a whole day, but the times in between that are plateaued. So I might have like a really, really bad day or time, and then I'll plateau for longer periods of time rather than just being low all the time, So what I would say to a state legislator would be to fund all recovery services, especially funding more residential living programs, and looking into emergency room reform. These are beautiful, talented people with a lot of potential that we're losing every day, and they deserve good care. They deserve the funding. Yeah, I guess that's it.
That you would give them?
So I would give a parent the advice, if they just found out that their child was using or their loved one was using, I would tell them to first speak with their doctor, pediatrician, and I would tell them to maybe look into Nar-Anon or Al-Anon, and also look to the community, just even Google community services. In our area, we have SOARS, we have Recovery Fitness, we have Angels of Mercy, and we have Gates to Recovery, Hope Dealers Be the Change. Yeah, I would say to look into those organizations for support and help. They're all on Facebook.